work. So a patient will, before the operation, will do a scrub like a surgeon would do at the sink before an operation. And then once they'll come into the operating theatre, they'll get their spinal anaesthetic in, so they're getting numb. And when they're lying down on the bed, we'll wash their hands again for them. The theatre staff will help with that. We'll put on a surgical gown and surgical gloves. And then the woman will lie there with her hands, keeping herself sterile. And that's really important because she's putting her hands into an operating field, right?
Yeah.
So we have to make sure that she maintains her sterility in terms of her hands. And then I'll deliver the baby's head. And then we'll tilt the table a bit so that she can see what's going on. I'll guide her hands down. She can touch her baby whilst it's still in her womb and get to know it. And then when she's ready, we'll get her to lift her baby up by putting really hands under the armpits and around the thorax and just lifting the baby up in a big arc so that she can see it, hold it, look at it, and then straight up onto her chest so she can do skin to skin immediately.
That is unbelievable. There's literal tears in my eyes just hearing about that. That's mind-blowing. What's the next steps for something like that? Because obviously she's now on the chest. Are we now at the stage of a normal vaginal birth, or?
Well, we've still got to put everything back together again from the Caesar, right? Yeah. So we try and do some delayed cord clamping for a minute or so that, and that's really important for healthy babies. And then we cut the cord, and mum and baby can just sit together and cuddle. Pediatrician might want to check the baby out, but not always. And then mum and baby can just stay together with dad as well while I finish what I need to do. And the rest of the operation usually takes about 20, 25 minutes of putting everything back together. And then the three of them will go together or almost together to the recovery area outside of the operating theatre.
What a journey. Like, that's incredible. Have you found that there's a lot of people who opt in for this when they're given that option?
Yeah, I think there are some people who are intimidated by the thought of seeing more in the operating theatre and who are very intimidated by a theatre environment and who choose not to do it. And I'm really conscious, again, of not railroading people. So I don't force maternal assisted caesarean sections or I certainly don't want to make people feel that they're being pushed down a certain pathway. So I offer it. And then we discuss it, and then I'm happy for people to make decisions. And I think about half of people, a third to a half of people who have the discussion decide that they want to do it. But there's still plenty of people who just say, you know what, I don't want to see any of that. Just show me the baby.
I think having that option, though, it's just incredible to give people that opportunity, especially if they were on their journey. They're being told that maybe another step is going to be required, and it gives them that opportunity to still be literally hands-on and involved in that. So
and I think the people who really cherish it in particular, I think everyone who I've done a maternal assisted caesarean with has found it an incredibly positive and enjoyable experience. And even people who were nervous about it but who decided they wanted to do it, their nerves just disappear as soon as they see and touch their baby, right? And everyone has loved it. But I think the people that really benefit the most from it are people who missed out on a certain element of the birth that they had last time.
Yeah.
So they were desperately hoping for a vaginal birth, got rushed in for an emergency Caesar, didn't get the image of birth that they had fixed in their mind, and they've carried that baggage with them, for a year or 2 years or whatever until they have their next birth. And when those people have the opportunity to do a maternal assisted caesarean, you said tears in your eyes. I've cried in maternal assisted caesareans because you just see the joy in people's. You see the raw emotion, right? One of the things about obstetrics that I love, but which can be overwhelming at times, is the absolute raw emotion. Sometimes it can be. It's good most of the time. It can be bad sometimes as well, of course, because outcomes aren't always good. But that raw emotion of someone who gets to deliver her baby by caesarean section herself is quite spectacular.
Yeah, and I think that